Hello viewers, this is Dr. Margaret Nakiganda, a dentist at Emmanuel Medical Center, and I'm going to get you through the dental department and its procedures. At Emmanuel Medical Center, in the dental department, we care for your oral health, and that inclusive of your oral health education, where we do the consultations. We also do scaling and polishing, that is all about oral hygiene. We also do about teeth extractions in case we have decays. We do implants, bridges, crown in case we have edentulous spaces, or if someone has removed their teeth. At Emmanuel, still in the dental department, we do what we call implants, where we put those artificial teeth. We also do orthodontic treatments, where we do braces, we do splittings, we do health care, especially when these people have gotten braces. So you're all invited for our treatment. So our department covers both pediatric dentistry and the adult dentistry. And basically when we look at fluoridation and varnish, basically deal with the pediatric, the children. So fluorides are very important in teeth formation, and that's why we do a lot of varnish and fluoridation in children, because we want to keep their teeth, since they're at a stage where there is a lot of decay in them, because most of them get sick and they're always depending on syrups. So we cover them on varnishes and fluorides such that their teeth are stronger. And in adults, we actually advise all our clients or our patients to use fluoridated toothpastes, because we need the fluorides to keep our teeth very hard, strong, without cavities. So fluoridation, when it comes in the dental department or when it comes to oral health, it is very important. What causes bleeding gums? Most of us, we love eating very, very sugary, or we just love generally eating, but then we don't really take care of brushing after eating. So most of the times, when this food mixes with saliva, they cause what we call calliculus, deposition on our teeth. So you find that someone's teeth are presented with green or yellow or black calliculus on them, and then those stuff are so rough that during brushing you can easily bleed. So every time food is kept in the mouth, the gums tend to react, because they don't love dirty environment. You have to keep the mouth clean, and that's why people bleed, because gums are reacting to dirtiness in the mouth. So you checking up with a dentist every after 6 months is very important to keep oral hygiene, such that such diseases like bleeding gums, gingivitis, acute periodontitis, where even teeth can reach a time and they move out by themselves. So to prevent all that, we need to keep polishing and scaling, and that is done by the dentist. Both mouthwashes and brushing are very important practices to keep our oral hygiene. So I'm going to start with brushing. When we brush our teeth effectively, that is after food, because we want to keep food out of our mouth, it means we are protecting our teeth from decay, because we are removing food that these microorganisms normally in our mouth keep on eating to produce that pyruvic acid that keeps on damaging our teeth. So every time we brush, it means we are keeping our mouth protective. So fluoridation is very important, brushing is very important. And also mouthwashing is so important, because most of our mouthwashes, they have antibacterial effect. It means they're not going to let this bacteria destroy your teeth. They'll be killing them effectively. So we say both brushing and mouthwashing, they are very important practices in keeping our teeth healthy. You using a toothbrush and not doing a mouthwash, we can say you are at chances of 70% keeping your teeth, because most of the teeth decay because of food in the mouth. So when you keep brushing, it means you're protecting our mouth. But a double protection comes with use of a mouthwash. Okay? So I would say you cannot use a mouth without brushing. That is very wrong, because your left food you're just rinsing. With a mouthwash, we rinse and then we protect the mouth because we kill the bacteria, but we are not removing food. It means our teeth are susceptible to issues like calliculus, where we are going to get dirty teeth. So brushing without a mouthwash, it is 70% protective, but using a mouthwash minus brushing, no, that is wrong. What is a root canal? A root canal therapy is a therapy we use when we have a tooth that we're supposed to protect, but it has gotten damaged. So we do a root canal. That is a process in which we remove the nerves of the tooth such that you remain with your tooth. It is dead but functional. It enables us not to have a lot of spaces in the mouth. So it is very important because it enables us to keep our teeth in the mouth minus losing them. Yes, when we come to future dentistry or the dentistry that we practice right now, we recommend someone, or we fight so hard that this someone can maintain their teeth, can have their teeth. So we do such procedures to make sure that these teeth are maintained within the mouth, because we want someone with a good smile, we want someone who is able to eat, we want someone who can crush meat. Are there dangers of tooth removal? Yes, I can say yes perfectly, because the dentistry that we are practicing today, we would not love someone to be in an environment or to be in a society when they cannot smile. Because every time we remove teeth, it means someone is getting spaces, someone is getting, we used to call them goals when we were extracting kids. So we don't want someone to have a bad laugh or a smile. So we don't so much want to remove teeth today. We actually do root canal therapy, a lot of it. And also, we don't want to remove because it is very, very uncomfortable for you to eat when some of the teeth are missing. It means food is just going to be jumping throughout those, those spaces. So it is kind of irritating for you when you're eating. So we love someone to have a very nice meal, very happily and very comfortable, because their teeth are there. So we don't advise extractions. When is someone supposed to come for a dental checkup or a consultation? Most of the time as dental dentists, we advise someone to check on us about 6 months. That means half in a year, to check, do we have any caries, do we have any cavities, are our gums okay, do we have anything in the mouth that is susceptible to maybe oral cancers, or because many people are practicing different habits that can lead to so many things that can raise within our mouth. So after every 6 months, please, you're advised to check on us. You can check on us at Emmanuel Medical Center. We are always available. Okay. What causes teeth stains and how do we avoid them? Teeth stains, basically, they are caused by, we look at mostly diet. Most of us love eating chocolate, love taking coffee all the time. So you find that such diet always stains our teeth. So most of the times you're advised to check on a dentist such that we do a procedure which we call scaling and polishing, such that we polish off all those stains and then your teeth can look better, or they can even, be white enough. Most of the time, people who have bad breath are most likely to have unclean or unhygienic mouth. It comes when my teeth have a lot of calliculus, or when it is a little bit dirty, when food is, has maintained into there, and also when someone has a lot of cavities or holes in the mouth. Since food hibernates in there and ferments from there, that decay of that food can make someone really have a bad smell. So please always check out with your dentistry to cover all the holes or the cavities you have in your mouth. But also another thing is when someone has gum issues, gingivitis, acute periodontitis, where the gums are irritated or they are sick, still they are going to have that bad breath. Reason being, these gums, sometimes they produce pus, sometimes they have wounds. So basically all that can cause someone to have a bad smell. But since also we look at infections in the body, some people have ulcers, and remember, a mouth it opens up to almost all the system. It is connected to the ear, it is connected to the nose, it is connected to the stomach. So someone who has wounds, someone who is having issues with the ears, someone who has every time cough or flu, they are most likely to have that bad smell because the system is connected. And then also another thing, we look at your habits. Some people, you know, we're having work where you keep quiet a lot, or sometimes within their personal life that some are so quiet that every time the mouth is just silent. Such a person is also most likely to have also halitosis or a bad smell. So we advise, one, because of hygiene of the mouth, we advise someone to always check out with a dentist for brushing, or what we call scaling and polishing. Another thing is that we also want you to go and check out with doctors if you have any issues with your ears or your nose or wounds in the stomach, what we call ulcers. Please go and treat yourself. And also with habits, please sometimes move within with a lozenge, or talk to a friend such that you're not quiet every time, to prevent bad smell. Does tooth whitening paste work? I would say yes, it does. Basically, we love to do teeth whitening in specific conditions. When I talk about teeth whitening as a procedure when it comes to the dental unit, most of us come from areas which are highly fluoridated. You can see people like from Kasese, people like from Ngoma, their teeth are so highly fluoridated because their water and the soils where they get food from are highly fluoridated. So you find that their teeth have either very deep white patches or they have brown within them. So such people always we advise to do whitening. It can be clinical through the clinic, or you can buy the whitening paste to keep your teeth in a better color and better, of course, smile. Which toothpaste do dentists recommend? Long ago, dentists used to recommend a lot of Colgate because 100% in that toothpaste we look for the fluoride, because that is one of the most favorable mineral that our teeth love, or our teeth get stronger through that mineral. So when it comes to toothpaste, we recommend so much of Colgate because it has it in a percentage that we need it. That's why most of the times we recommend it. But still, there are so many brands that have come on market. As long as you see your brand is having fluoridation or fluoridated or sodium fluorophosphate or sodium monophosphate, and it is in 1%, that toothpaste is very good for your teeth. But when it has lesser than that or more than that, then expect that that toothpaste is not good for your teeth health. Is teeth sensitivity a disease or a disorder? Teeth sensitivity is not a disease, but it can be caused because of the cavities we have in the tooth. Remember, our enamel on our tooth is an insulator, but the other parts of the tooth, like the dentine or the pulp, are very sensitive. So once a person has cavities in the teeth, expect someone to have sensitivity, especially maybe they have taken something hot or cold. So cavities can lead to sensitivity. And also our habits. There are people who are really, they like eating very hard or crunchy foods, popcorns all the time, bony meat all the time, and you find that you're causing teeth wearing, you're wearing the enamel away, which is the insulator, and you're exposing the dentine, which has nervous endings. So basically, you may result into teeth sensitivity because you're exposing the nerves outside. So please visit a dentist, and then they can provide you with certain sensitive toothpastes such that the sensitivity can be improved. Thank you. How safe is dental amalgam? We are in an era where we say we are practicing dentistry from the future. Amalgam is one of those old cements that were used in dental, and they discover that the mercury content in it is very dangerous to the human body, especially when it is taken through the body and consumed. someone's percentage of getting cancer is really high. So we are trying to avoid it so much, and that's why now we have introduced in new cements like Fuji9, Glasionomer 3, we've introduced in zinc phosphate, we've introduced in calcium hydroxide, such that we get away from amalgam because of its mercury content. So please avoid it.